Malik. Today we will talk about an important topic by name inflammation. Inflammation. What exactly is inflammation? What exactly is inflammation? Inflammation is nothing but the body's response to outside factors. That is suppose you get you are having an injury to the hand. Suddenly the hand swells. There will be swelling in the hand. Suppose you had an injury to the hand, there will be swelling in the hand. Suppose there are bacteria, there is some infection in the body's response is called inflammation. Inflammation is the initial response of the body to the to any infection or any injury to the body or any infection to the body. The immediate response from the body is called inflammation. What the body responds is called inflammation. So why I am talking about this topic today is the most important thing is recently in the last 1 week we got about 3 cases. Number one, first patient came with stroke. He is about 45-year-old gentleman, man. He came with his parents. His father and mother are alive. Well, they are able to walk, they are normal. And he came with wife and parents, both the parents, wife and husband and wife. They came together to get him to the hospital. Okay, so he suffered a stroke. And he was having paralysis of one side, slurring of speech, inability, difficulty in seeing objects. This was the case. And number two, another 2 days back, we got another case where the patient suffered a heart attack. He is a 39-year-old male. Father and mother are fine. They came to the hospital and wife is also with him. So understand this. The patient suffered a heart attack at the age of 39. We sent him to nearest cardiologist after initial treatment. He was put a stent. And one more thing is, one more patient came with gangrene of the foot. Right foot got gangrene. That means it has changed the color. It is about to almost, it came in a rotten stage of the right foot. There is no blood supply to the right foot. That means the arteries going to the right foot are damaged. So we had to do, first initially we tried for saving the foot. He's still under treatment. But parents are fine, and they came to the hospital to see him. He's also about 45-year-old gentleman. So understand this, that all the problems are not hereditary. Though there is some hereditary factor, it depends on what you are eating, your personal things. Your 80% depends on the thing which you are eating. 20% depends on what you are doing, exercise daily. So 20% exercise, 80% diet is the most important thing. So don't throw everything on hereditary factors, because here the parents are fine but the children are suffering. So what is inflammation? Where the inflammation comes from? So inflammation is, I told you, it's a body's response. See, inflammation, nowadays there is a very good concept that everything is starting in your stomach. From mouth to the anus, there is mouth, oral cavity, there is esophagus, there is stomach, small intestine, large intestine, and then the anus. Nearly 10 meters of gut is there. So here is the main problem. See, gut bacterial flora. Previously this is called gut bacterial flora. There are plenty of bacteria inside your gut, inside your stomach, inside your intestines. There is plenty of bacteria which are good bacteria. 1,000 species of bacteria, 1,000 varieties of bacteria, nearly some crores of bacteria are there inside your body. Once the bacterial structure gets damaged, once the healthy bacterial structure gets damaged, because of antibiotics, chronic use of antibiotics and irregular lifestyles, and not taking doing good exercise. Previously also I did one topic called gut microbiome. Try to see that topic. And important thing is to have healthy bacteria inside your stomach and intestines. How you get it, I will tell you. And I told you previously also in gut microbiome. If this is healthy, see, if the gut bacterial flow are not healthy, if they are damaged, If bad bacteria come and join inside the stomach, if healthy bacteria is not there, what are you liable to get? Strokes, that is, you are likely to get paralysis and all. MI, heart attacks, atherosclerosis, that means the blood vessels get damaged. The blood vessels get damaged. You are likely to get blocks in the blood vessels, and likely to get gangrene of the foot or anything can get damaged. Kidney, there are blood vessels going to the kidney, blood vessels going to the liver. These are all the things which can get damaged. Blood vessels are going to the intestine. You can develop intestinal gangrene. That means gangrene of the bowel, intestine, small intestine, large intestine, etc. And autoimmune diseases. What are autoimmune diseases? Autoimmune diseases means your body is fighting against your own body cells. That means you are seeing vitiligo, that white patches everywhere on the face and body, vitiligo, okay? And this is also a type of autoimmune disease. And most of the connective tissue disorders, for example, knee joint pains, body pains, multiple joint pains, these are all autoimmune diseases. Multiple autoimmune diseases are coming nowadays in young age. They are all because this bacterial flora is disturbed. And when it is disturbed, it causes inflammation. I will tell you how it is. See, this is your intestine. This particular one is your intestine. So intestine has got inner lining. It is called mucosa. See, this is a blood vessel. Inner lining is called endothelium. Blood vessels. This is heart. It has got 3 blood vessels for blood supply. And this is neck. It has got 2 important blood vessels, that is carotid arteries, left carotid artery, right carotid artery, which go inside the brain and branch like this, multiple small vessels. These are the big arteries, carotids, which are supplying the head and brain, mainly the brain, okay? So, most important thing is, see, why I am telling you about this is, even these arteries which are supplying the heart is supplied by 3 major arteries, left coronary, right coronary, circumflex. They also have the same structure, like endothelial lining, thin endothelial lining. I will tell you what this is, okay? Every blood vessel has got endothelial lining. Here, this is the intestine. This is the intestine, which has got internal lining. This is not called endothelium, it is called mucosa. Okay? Blood vessel inside layer is called endothelium. Here it is also like endothelium, but this is called mucosa. This is mucosa. So this is intestine and this is mucosa. The outside, see, if this is the blood vessel, there are plenty of tissue around the intestine. This is the intestine, plenty of tissue around the intestine, right? In this tissue, there are something called T cells, also called T red cells, B cells, etc. So inside the intestine, there are multiple species of bacteria. I told you thousands of species of bacteria, nearly crores of bacteria, but minimum thousands of species of bacteria. Okay, minimum thousands of species of bacteria. So what happens is, these bacteria inside the intestine, are constantly in touch with surrounding T cells, B cells, mainly T red cells. These are T red cells which are continuously in touch with these bacteria, and they recognize, they always are bothered what type of bacteria is there inside. Are they good bacteria which are helpful to the body, or are they bad bacteria which damage the body? Suppose here there are good bacteria, that is very helpful bacteria to the intestine, normal bacterial flora. That is means normal bacterial flora, thousands of species are there. Then they release some acids, some enzymes, etc. These are all useful for digestion of the food, and healthy body healthy body without any diseases, without any autoimmune diseases or whatever disease. Well, they keep the body, they are involved in all the biochemical processes, biomedical processes inside the body, and they keep the man or woman healthy. They keep the human being healthy. So they release, this is short chained fatty acids, SCFA. They release good bacteria, they release short chain fatty acids, like multiple things like this. So they keep the gut and total body very healthy. Suppose here, then see, if the good bacteria are there, these T cells, red cells, which cause inflammation, which are responsible for inflammation, that is body response, they keep quiet. They keep quiet because they are constantly in touch. They are constantly in touch. It is something like a memory. They always see which bacteria are there and they respond according to that. So the T red cells, they behave according to this. If the bacteria are good, that is friendly bacteria, so they keep quiet. They don't do any harm to the body. They just silently sit. If the bacteria are bad, suppose if the bacteria are bad bacteria enter, these red cells, T red cells, immediately act to damage them, immediately act, causing inflammation. That means they try to repair. These T red cells, they try to repair. So what happens? This particular mucosa gets damaged. This is called leaking gut. Gut leakage. That means this mucosa gets damaged. And from there the inflammation goes on spreading. And the inflammation will go to total body, all the blood vessels, all the connective tissues inside the body. The inflammation process starts. From here and it enters the body. For example, what happens during inflammation? Let us talk about one blood vessel. If one blood vessel we talk, it happens to every blood vessel. For example, the carotid blood vessels which are going to the brain, and the heart blood vessels which are supplying the heart everywhere. The blood vessels which are supplying the legs, the blood vessels which are supplying the total body, all the vital organs, they get damaged. Once inflammation starts here, okay, if the healthy bacteria are there, they are secreting good SCFC, that means short chain fatty acids or other enzymes and other acids which are helpful to the body. T cells are silent, nothing will happen, everything will be stable. And suppose there are bad bacteria, they are recognized immediately by T red cells and inflammation process starts. What is inflammation process is, the blood vessels, here is the blood vessel. So blood vessel, there is inner lining called endothelium. This is called endothelium. So this endothelium gets damaged. And here cholesterol, triglycerides, T cells, B cells, etc. So many cells get accumulated. Once the endothelium is damaged, this is damaged. So it forms a plaque. So there are plaques inside the blood vessels. So there is the supply to the inside the blood flowing through the arteries, it is damaged. It is getting narrowed. The arteries is getting narrowed. Artery becomes thick, narrow, and suddenly if the inflammation is too much, if the inflammation is too high, this plaque ruptures. And here the blood, what is the blood that is flowing here, small clot will form here, small blood clot will form here, and there will be total occlusion of the vessel. The blood vessel gets totally occluded, completely blocked. This is what happens. Once this plaque ruptures, there will be a small blood clot there, and there will be rupture of the, as long as this plaque is soft, it is okay. Once this plaque becomes hard and some calcium also gets deposited inside, it becomes very hard, and anytime it can rupture. Soft plaques are okay, but hard plaques with calcium, that's why we do calcium score for heart and all. So this plaque if it becomes harder, if the plaque becomes hard with calcium and all, then any time it can rupture, like this, and there will be some blood clot formation here, and because blood is flowing, and there can be a total blockage of the blood vessel. This is what happens from gut inflammation, from inflammation here to the arteries here, end organ.